Hi, this is Dr. Tom McFadden here at Advanced Cosmetic Surgery in Greenville, South Carolina, and today we're going to talk about brachioplasty versus liposuction. Brachioplasty is an operation that removes excess skin primarily, but along with that can come some excess fat. And then the liposuction, of course, removes the fat, right? For each choice, though, each alternative, neither one improves the quality of the tissue that remains, okay? So it doesn't really tighten skin, or contract skin is probably a more accurate term. The brachioplasty removes most of the bad, really bad skin, and so overall you get a better result with skin quality from what remains. Liposuction, or any fat reduction procedure, only removes the fat, okay? It doesn't affect the skin quality whatsoever. Now, most people have loose skin and extra fat, okay? Depending upon the proportions, okay? If you have a lot of loose skin and some extra fat, brachioplasty is obviously the preferred choice. If you have a huge amount of fat and therefore expanded skin that comes with it, then you might entertain doing a liposuction first, debulk that area, develop some laxity, some play in the tissue, and then go ahead and do a brachioplasty. So it just really depends on what the priority is at the time. Brachioplasty certainly can remove a lot of fat at the same time as the skin. If you have a whole thick layer, though, it makes it a lot harder to close it, and closure is really important. We want a nice, smooth, pipe-like result for a brachioplasty, and we want it as tight as we can get, but we don't want to choke off the vessels. If you have a lot of thick fat, okay, then you might make that problem a little bit worse, and so you might get a lot of postoperative swelling downstream. You might even compromise the blood flow to the forearm and the hand. And we certainly don't want to do that. So we always have to be very cognizant of that. So recovery from brachioplasty and or liposuction. Brachioplasty, again, just a skin incision. It's a long skin incision. The skin incision typically takes a couple of days to get rid of most of the acute pain. There's really not a whole lot of underlying pain from brachioplasty. The typical result can be seen as soon as 6 to 8 weeks. But you probably should wait 3 or 4 months, let everything settle down, let the dust settle, as they say. The same can be true for liposuction, if that's an option that you're considering. So liposuction results typically can be seen in, for the most part, in 6 weeks, but really you do have a little bit of swelling reduction that happens over the next month or two. It just depends on how much work was done. If a lot of work was done, you have a lot of swelling. A little bit of work was done, in other words, you didn't have a whole lot of fat, you had a little bit of fat to remove, then you have a lot less swelling. But typically it takes, I would say, 2 to 3 months, 4 months maybe, to see your final result. And you do need to wear a compression garment for either brachioplasty or liposuction, or both, for at least 6 weeks or until the swelling's gone, whichever takes longer. As far as pain goes, the brachioplasty itself is not a terribly painful operation. Liposuction, there's more bruising than even brachioplasty, and that's really what causes most of the pain postoperatively. So you see big old bruises, you see some swelling as a result of liposuction. There's a lot of passes that need to be made during the liposuction procedure. And some nerves can get really banged up during that procedure. So actually the liposuction may take longer to recover from a pain and swelling perspective. But usually it's much, much better after 3 or 4 weeks. Some people ask if drains are necessary for brachioplasty or liposuction. Personally, I hate drains. Okay, I really only use drains in abdominoplasties, and I use drains in breast reconstruction. That's it. I tried drainless abdominoplasties in 2003, way before everyone else did. And the bottom line answer is it works sometimes and it doesn't work other times. It works better for smaller people with less liposuction. It doesn't work better for larger people. That's pretty much it. After having so much fluid accumulation, I decided to go back to drains. The drains are worth it in the long run. So I hope you enjoyed that video on brachioplasty versus liposuction. Be sure to like and subscribe, and we'll see you again soon on the next video. Thanks.